Hello everyone, welcome back to the Q&A discussion series. So in today's discussion, we'll talk about some important facts about the drug thalidomide. So before I get into the important facts of thalidomide, let me start with a question for you. Which isomer of thalidomide is contraindicated in pregnancy? A. R isomer, B. S isomer, C. Both R and S isomer, D. None of the above. So as you all know, thalidomide is a drug which was developed by a Swiss pharmaceutical company, which was later on acquired by a German company. So it was initially used as a sedative drug or a tranquilizer drug. So this was the initial use of this thalidomide, but later on, this drug was used in morning sickness. That means it can decrease vomiting in the first trimester of pregnancy. First trimester of pregnancy. Okay. Now, when reports came, there was severe malformation in children born to mother using thalidomide. Okay. As you can see in this picture, there is severe malformation of the limbs and the arms. So this effect is called as phocomelia, and phocomelia is a teratogenic effect of thalidomide. Therefore, it is contraindicated in pregnancy, and later on, this drug was withdrawn from the market. And the reason for this phocomelia is due to, it was found that it is due to the inhibition of a protein called as cereblone protein in the fetus. Okay, so due to the inhibition of the cereblone protein in the fetus, the severe malformation in the limbs and arms was seen, which is called as phocomelia, and therefore it is contraindicated in pregnancy, and the drug was withdrawn from the market. Okay, now the question is, which isomer of thalidomide is contraindicated in pregnancy? So if you go with the S isomer, the answer is wrong. Let me state the fact. As I told, the thalidomide was introduced to the market with due to its sedative property. It can also be used in morning sickness. So this effect is contributed by the R isomer of the thalidomide. So the sedative property and morning sickness is due to the treatment of morning sickness is due to the R isomer of the thalidomide, whereas the teratogenic effect is mainly due to the S isomer or S enantiomer of thalidomide. Now, when you give this R isomer, this will be converted to S isomer, and reversely the S isomer can convert back to R isomer. So this is called as enantiomeric interconversion. So even if you give R isomer, it would be converted to the S isomer, and S could be converted to R. So this property is called as enantiomeric interconversion. Okay, so what is the answer for this question? Which isomer is contraindicated in pregnancy? Yes, both R and S is contraindicated in pregnancy. All if the question is which isomer causes teratogenic effect, the answer is S isomer. And if the question is which is contraindicated, both are contraindicated because due to this property called as enantiomeric interconversion. Okay, so these are the important points. Now later on, this drug was reintroduced to the market due to its immunomodulatory property and anti-tumor property. Due to its anti-tumor property, it is used in the treatment of this multiple myeloma, a blood cancer affecting the plasma cells. So that is how it has been reintroduced to the market. Also, I told you this has found to be having immunomodulatory property. So it is used in the leprosy for type 2 lepra reaction. Type 2 lepra reaction. Type 2 lepra reaction is called as ENL, erythema nodosum leprosa. Okay. Now, it is also used in orogenital ulcers seen in the HIV positive patients. So that is how it has been reintroduced in the market. So the point you need to remember, this was the teratogenic effect is due to S thalidomide. However, both isomer are contraindicated in pregnancy due to enantiomeric interconversion. And which protein causes teratogenic? Which mechanism causes teratogenic effect? Inhibition of cereblone protein. So the best answer for this question is both R and S isomer. So hope you understood this discussion session. Keep on watching. Thank you so much.